Hi, this is Jackie with Panama Relocation Tours. Thank you so much for joining us for our Saturday live stream. Today, you're in for a special treat because you're going to get to meet a Panamanian doctor. He works at the Pacifica Salud Hospital that's in Panama City. It's a Johns Hopkins Hospital. Many of our clients have been to see him or done telemedicine with him. Or just gone to his office to see him, and we just get rave reviews about this doctor. So I know you're going to enjoy meeting him. I'll bring him on screen in just a few minutes. I have just a couple of announcements to make first. Number one announcement is I know you have a bunch of questions for this doctor, and please hold off on your questions until I tell you you can ask a question, because we may discuss the answer to your question before you even ask it. So let us have a little talk first. Then about 20 or 30 minutes into the live stream, I'll pop your questions up on the screen. A couple of other announcements is next Wednesday is when I would normally have my Move to Panama Q&A live stream, and I won't be having one next Wednesday because I'll be in Panama City for some important meetings and I won't be able to do the live stream. However, on December the 14th, we have a special live stream and interview with a veteran service officer that's going to talk about the veterans medical benefits, VA, TRICARE, FMP for the Foreign Medical Program, CHAMP VA, all those different things, what's available to you in Panama and how to qualify. And then on the 18th of December, you don't want to miss it. Put it on your calendar right now for the 18th of December, because you may have remembered that for the last 4 years, I've been working on trying to bring some companies into Panama that would be able to handle billing for hospitals to be able to accept Medicare Advantage and some other U.S. insurances they were not accepting. So we have some hospitals set up. The owner of the billing company is going to come and talk about which hospitals can accept Medicare Advantage and other U.S. insurances, and also some other special things for you about air ambulances, ambulance service, and some other things. So mark your calendar for 5 p.m. Central, 6 o'clock Eastern Time for the 18th of December for that talk. So without further ado, I'm going to bring on our special guest. Hi, Juan.
Hi, Jackie.
Thank you so much.
PRT family.
Yeah, the PRT family, exactly. So thank you so much for being here and taking time away from your Saturday. I know it's the night for you to go out and party in Panama City, and I appreciate you giving us.
It's my pleasure.
Yeah, just 1 hour of your time, and then you can go do your partying.
I live to serve.
Okay. So Juan, as you know, we work with a lot of people that are moving to Panama. People from all over the world are moving to Panama because it's such an amazing country. I don't know if you know it or not, but International Living recently ranked Panama as the #1 place to move to in the whole world. Yeah, to move to a retirement. We already knew that, of course.
Right.
But they're finally coming around to the realization that, yes, Panama is #1.
Finally they get it.
Yeah, and they've had us on the list before, but I'm really honored that Panama made the list again, because I've traveled all over the world, and I absolutely think that Panama is the best place to live. But one of the concerns that people always have, there's two concerns when it comes to healthcare. One of them is that some people can't get health insurance if they have pre-existing conditions or if they're a certain age, and I'm working on some solutions for that, which I'll share with you next week when I see you in Panama City. But the other concern that people have is, do the doctors speak English? What if I'm diabetic? What if I have, autoimmune diseases? What if I have this? What if I have that? Can they even take care of that in Panama? So that's some of the things that I want to talk about, is if people have some concerns about whether or not Panama doctors are going to be able to take care of them, if their medications are available, how can they find out what's available as far as specialists here?
Okay. We have a website in the hospital, and then there's a list of all the specialists who are available. And it even goes beyond the hospital. There's this other platform called CliniWeb, and you can just check all the doctors and probably the country who are signed up on that app, which are most of us.
Right.
But yeah, it gives you a pretty good look on the menu that you got to work with when you get here, for sure.
Right. I think that there's probably any specialist you would need is going to be
Yeah,
available
absolutely.
here
And
in Panama.
subspecialist and all that.
Now, you might have to travel to Panama City to go where the specialist is. Sometimes the specialist might do a couple days a week in David in Chiriquí province. So depending on where you live, you may have to go to Panama City, but in Panama City, definitely you can find any specialist that you need.
Absolutely. In the city, no doubt.
Right. So if someone does have some health concerns, that they got some pre-existing conditions, or, they're just know that they're getting a little bit older, what are recommendations that you would give someone that's moving to Panama? Should they bring their medical records? Should they bring their list of medications that they take? What should they bring with them?
Well, I'd say a medical report from their primary care physician would suffice. Which
Mhm.
and if any important stuff like CAT scans or things from back injuries, things like that, that'd be helpful too for the neurologist or whoever will be taking care of that.
Mhm.
But yeah, mostly a medical report from your primary care physician, kind of telling you what's been going on in the past, and then once you get here, we'll take the test, the necessary tests, and see what we're working with and how we can improve it.
Maybe do some new tests in Panama
Oh
City.
yeah, absolutely. That's what I meant. Once they get here, we'll do the battery test and see where they are right
Right.
now and where
Well,
they're going.
and what about medications? I know some people take quite a few medications and they're a little concerned that what they take might not be available here. But usually even if the medicine they take, the name brand isn't available, there's some other generic brand that's available in Panama. Is that right?
Yeah, absolutely. That's usually always the case. And even you might find the non-generic and the generic for, a fraction of the cost, like Lipitor or those, right?
Like that.
But I mean, we're gonna have everything available. And if we don't, even if we don't keep it in stock, most of the times you can just order them in with the pharmacy by a special order, right?
Well, an order. So one of the
Not
ways.
on all of them. I'm sorry, not on all of them because they have to be registered with our Ministry of Health.
Right.
But usually they are. So
Okay.
very few exceptions that
Right. So one of the ways that people can check the medications to see what's available and what's it going to cost here in Panama, on the Panama Relocation Tours website, in the upper right-hand corner, if you search drugs, it goes to a web page that has a link to two pharmacies, Farm Value, which is a very popular pharmacy, especially in Panama City, and also a Rocha, which is available everywhere here in Panama. And on that website, you can put in the medications that you take and see if it's available. Now, if it says not available, you might have to search what the generic name is for that medication to see if it's available.
All right, but it's always right on the bottom, so you can, even if you're not used to that name, you under the name brand, you're always going to see the formula and
the generic.
Okay. Yeah,
the
generic name, and just search that one. Usually you switch an E for an A at the end there, but even if you type it in English, it'll show up because it's close enough.
Yeah, it'll show up. Of course, the other thing you can do is set up a telemedicine consultation with Juan, and
absolutely.
and
I'm glad to help you out as well.
Yeah, and he can let you know if your medications are available. So it's good to know that if their medication is not available here in Panama, there's a possibility that some of the pharmacies might be able to order it and get it for them. Is
absolutely.
that right?
Specifically the one in our hospital.
Yeah, hospital.
I haven't tried with the other ones, but when I can't find one, it's usually that pharmacy, I go to, of course, and they tell me, okay, we can order that in.
Right. Some of our clients, they have Medicare or Medicare Advantage in the United States, and so if they ordered from like Amazon Pharmacy or some other online pharmacy in the United States, they could get their medication sent here, and they're only like $3. But that's going to require that they get a prescription from their doctor in the United States and then ship the medications here. But I'm sure that there are some medications that you cannot, as an individual, that you can't ship into Panama, like opiates or other things. Do you know what the restrictions are?
I am not sure, but probably the opiates, because there's a pretty tight leash on those.
Yeah.
There's not that many available, but I mean, there are some, the essential ones, but you know, you need a different type of script to prescribe those, special with copies and all that stuff. It's very controlled.
So, so George and everybody else, if you could please hold off on your questions until Juan and I finish talking a little bit, then we'll start taking your questions shortly. So speaking of opiates, if somebody is on some pretty heavy duty pain medication from some injuries that they had, are there pain management doctors and pain
Absolutely.
management clinics?
I just recommended one recently. So yes, we definitely have those.
Yeah.
Several. So definitely don't worry if that's a concern. You know, put it behind you. We'll take care of you here in Panama.
Okay. And another question is, what about things like knee replacement, hip replacement, stuff like that? As people get older, some people might need that. Is that going to be available here in Panama?
Absolutely. We got great orthopedic surgeons here, and it's going to be at a fraction of what would cost you up in the States for sure.
Right.
And top-notch, you know, facilities, everything. Just like we were back home. Even better, maybe.
I know several of our clients, they've gone to Pacifica Salud when they were having a heart attack and they were taken care of with no problems, or when they thought they were having a stroke, but it was really just super high blood pressure that they were able to bring back down. So the doctors in Panama, they have got really good training to know how to handle basically any medical emergency that can come up.
Absolutely. I concur.
Yeah. So I know some people, you know, if I need to see a doctor, I'm going to see a doctor maybe twice a year. I see a doctor because I'm lucky that I'm healthy and I don't have any medical problems. But some people, they don't want to see a doctor. They would prefer to see what they call a functional doctor or a holistic doctor, alternative doctor, something like that. Do you know if that's available here in Panama?
Yes, we also have that available. And I know of a few names. So definitely come to me and I'll point you in the right direction for that too.
Like homeopathy?
Like holistic medicine. Yeah, definitely. There's people who, you know, make a living off of that.
Right. Once again, you know, let's say you lived in Los Tablas, it might not be available there. You might have to go to Panama City or to David to be able to find that doctor, but it's going to be available. So that's the important thing. And some of the doctors, you know, you don't have to go to their office. You can do telemedicine, you know, just like we're doing right now. You could do telemedicine with the doctor without actually going in. But sometimes it's so cheap to get on a bus and go from one end of Panama to the other. It might be better to just go see your doctor.
Right. It's better if you come in. If you're in the country, well, we can check your blood pressure, get your measurements and all that, see where if there's been an improvement since last time, that kind of thing.
Right. So many people like to get like a comprehensive annual exam that includes all the lab work, you know, just, you know, whatever might need to be done based on their age. Do you have like an executive plan or something for a comprehensive medical that people might want to do?
There is an executive plan in the hospital. It's done with it's with different doctors, but there is something available that you can. In the website, I think it's under medical tourism. It might be now on the Pacifica Salud website. But there's definitely an executive plan. There's that's set up in the hospital.
Yeah, and I'll post the link to the website for Pacifica Salud. I'll post it in the show notes underneath this video whenever it's over.
And it's got the English option that you put the whole page in English.
Yeah, and also even the doctors, you know, with a list of doctors and the different specialists on the website, which ones speak English, because most of the doctors do, but not all of them do.
Right. You go into their profiles and it's written on the bottom which languages they speak. Right. Most of them. Some just haven't gone in there and it'll just say Spanish, so you got to ask. But most of them, they have that set up there.
Yeah. So another question that comes up quite often is to get a residency visa for a foreigner to get a residency visa in Panama, they have to get a health certificate. And I know some attorneys, they just, you know, ask the people a couple of questions and they call a doctor and they get a health certificate without it actually visiting the doctor. But some of the immigration attorneys, you actually have to visit a doctor. Do you know what's involved? You know, what could possibly prevent someone from getting a residency visa for that health certificate? Do you know of anything?
I've never heard of anybody gotten rejected for that, and
Yeah, I
I
know
don't know what kind of red flags they'd be looking for, but
a long time ago, like in 2010 when I moved here, if you had HIV,
that's
then
what I
you,
was thinking. That's
yeah,
what I
that
was
was
thinking.
the
Like
only thing.
maybe that could be
HIV.
it.
Yeah, but I'm not even sure that that's a disqualifier anymore.
Yeah, I wouldn't be so sure either. And of course, because the pensionado visas has been going on since forever. So a lot of people come here with high blood pressure, diabetes, high cholesterol, all that stuff, and they all come in. They all make it.
Right.
So we welcome that too. No worries.
Yep. Yep. Do you know if if people have a prescription from their doctor from Canada or from some other country, do you know if they can fill that prescription in Panama, or do all prescriptions have to come from a Panamanian doctor?
No, if the medication is OTC, which most of them are, then it doesn't matter. I mean, as long as the pharmacy knows what medication they're trying to buy, they'll provide it if they have it in stock for sure.
Oh.
But because that's a big difference. A lot of medications here are OTC that are not over
Yeah,
there.
over the counter. Yeah, you don't need a medication. I think the only restrictions are going to be for antibiotics and for narcotics.
Right,
You,
right.
you need a
Yeah.
prescription for that. But for most other things, I think someone told me that if you wanted Ambien, then you needed a prescription. But if you got like a generic Ambien, then you didn't need the prescription. But I don't know.
No, Ambien's definitely on there. The benzodiazepines, the same control as benzodiazepines, which is very similar. So, at least in the city, definitely maybe you can find a pharmacy out there that maybe they're a little more lenient. But in the city, they're going to ask for a prescription always.
Right. So, something that I think is really important is that so many of my clients, they come to Panama and they're on like 3 high blood pressure medicines and 2 high cholesterol medications and maybe a couple of other medications for different things. Then they come to Panama and they tranquilo and they eat a better diet, and all of a sudden they get better, but they might be still taking those same medications. So it's really important when you come to Panama to establish a relationship with a doctor whenever you come here. And, perhaps, every 6 months at least, see a doctor for them to do some new tests and evaluate. Maybe you can cut your medications in half. Maybe you can eliminate your medications. So what would your recommend? Should it be every 3 months, every 6 months?
No, I'd say
If they're on
that.
medications, if they're getting rid of those medications.
Yeah, no, I'd say the yearly checkup, but on that one, then depending on how your labs come back and how you are, that might require a 3-month follow-up, a 6-month follow-up, or if everything's perfect, the whole year, right? Mm-hmm. But that depends on where they are, where they're standing as soon as those results are out, right? That's yeah.
Yeah, if you just start feeling better, instead of just making the decision yourself, well, I'm going to just quit taking my medications, you should probably consult. You should probably consult with your pro
before you do that, right? You don't want any surprises.
Work. Yeah. I had a really sad situation with one of our clients earlier this year. He was on all kinds of medications and he was just feeling so good living here in Panama. He said, I don't need those medications anymore. Then he had a heart attack. And it was so sad that he didn't make it with the heart attack. But just because he was feeling better doesn't mean that you should just stop taking your medications, especially not cold turkey. Maybe transition down, take a little bit less and a little bit less and a little bit less, but you need to be talking to a doctor.
Right, definitely. And so somebody can keep tabs on that, right?
Yeah.
Make sure it doesn't go out of hand.
Yep. So what other advice do you have as medical advice do you have for people that are considering moving to Panama? Maybe they have some existing medical conditions. What advice do you have for them?
No, I'd say make it down here. Don't let that deter you from coming to Panama. Any medical conditions, because we're equipped to handle everything, right? And even if it was to go on on the public sector, especially now that's all that's new stuff's opening up, right? Would still be able to take care of you even in the public sector.
Right. What about someone that's had a transplant? Do you have transplant medications, the anti-rejection transplant medications?
Yeah, yes, because we've done transplants here. The liver I think it's the only one that's done liver transplants so far in Central America. But yeah, so definitely we have all those transplant medications, anti-rejection medications that would be required to take.
Yeah. What about people that need that they have type 1 diabetes and they need a pump, a diabetic pump? Are those available in Panama?
I haven't seen them, but I did get a question from one of your clients, and they told me the brand of the pump, and that company is here. I think it was Medtronic or one of those.
Yeah, Medtronic.
Yeah, but the company's here, so I'm sure if they're here, they could definitely get those pumps in here, right? And even if in the off chance that they weren't, I'm sure you could order in too, right?
Yeah, you could order it and get it sent here.
Yeah, it's a lot of connectivity in Panama, so not a lot of problems getting things in here.
Yeah, so when people are moving here and with their medications that they're taking, to get through customs at the airport, some people just have a little pill organizer and that's all they have. But if they're bringing quite a few medications, should it be in the original bottle? Do they also need the original script from their doctor?
With that little orange bottle, that should suffice. But I've never heard of anybody having problems with that.
Okay.
Yeah,
okay.
But I mean, with the orange bottle, that's all the info that they're going to need at customs at least for that, because I mean, it shows who prescribed it and everything.
Yeah, I'm going to take a couple of questions. We got a lot of questions that are pouring in over here, so I'm going to go ahead and take a few of them. Jane says, if you have a script for oxycodone, can you carry it with you through customs?
Don't quote me on that, but yes. I mean, if it's prescribed, it's no problem. It's non-prescribed, right? but there's unless they pull you aside and check everything, right? But that shouldn't be a problem. If you have the prescription, no problem at all. Because I do know a relative that did that, and just show the scripts in that in customs in case they ask, right?
Yeah, Mark wants to know, are medications as readily available in the western part of the country as they are in Panama City? And what about getting refrigerated medications? Probably if you go to the hospital pharmacy, they'd be more readily available than a private pharmacy, right?
Right. But I mean, definitely up in Cherokee, in David, right, just in the main cities for sure. If anything's missing in the little towns and the outskirts, in the main cities, you're definitely fine. David, Chitre, Santiago, maybe Las Tablas, but Chitre closer. Probably a safer bet. Yeah.
So the questions are kind of scrolling off the screen. You guys might have to type your questions in 2 times if I don't get to it right away. So someone asked about getting a colonoscopy. I'm not sure I'm pronouncing that right. If you wanted to schedule one of those, what's the wait time for getting one?
A colonoscopy? That would be with a GI guy, but that's usually done pretty quick. Because if one's busy, you can always go to
if you went in one day, you could probably get it the next day with the same week.
Maybe not that quick, because you got to go see him first, right? To set the appointment, and then he'll determine to do the colonoscopy or not. Which, if you're going for that, he will. But yeah, I mean, but quick enough, because the GI guys, there's like 4 in one office. So in case you need it with an emergency, you can just ask who's got the soonest available appointment. And I'll give it to you for sure.
By the way, for those of you that are new to our channel, I thank you for being here, first of all, but also the protocol for asking a question is you have to type it into the chat window and put 3 question marks in front of it, so I know it's a question. So Lisa wants to know if there are any compound pharmacies in Panama.
What is a compound pharmacy?
Yeah, so compound pharmacy is where they make the drug into a little capsule based on a formula that the doctor's given them. It's not just buying a pill. I don't think
there might be. but
Yeah,
I don't know.
people have asked before, and I've never heard of it here. So Sylvia says, if I have to go to Panama City for surgery, will I be able to easily hire a nursing assistant to help with my aftercare in a hotel until I'm cleared for travel back home?
Yes, we definitely have nurses available that they'll do extra care for patients when they're not on, and there is companies that handle that. Yeah.
If you have our online Panama relocation guide, if you look in home health care in the section in there, we have several different names of several different people and several different companies that offer that service. It could be for just a couple of days, just a couple of hours, but it's readily available here in Panama. Someone else that already scrolled off the screen asked if you can get a CPAP machine in Panama.
Yes, we definitely have people here with obstructive sleep apnea that need CPAPs, and those are available here.
Yeah.
No doubt.
So Louisa says, in New York City, when you call an ambulance, you're taken to the nearest hospital unless you specify where you want to go. In Panama City, if you can you request to be taken to a specific hospital like Pacifica Salud?
Yes. On the 911, because it's rather new, that 911, but I hear it's reliable. I hear it's reliable, and yeah, of course, they'll take you to the hospital that you need to go, right?
Yeah, and
you gotta make sure they're gonna admit you, or they must have a way of figuring that out before, not to take you there and so be kicked out to the public one, because they gotta save time. But I'm sure that it can be accommodated.
Okay. This one, you're going to have to help me with the pronunciation because I don't know medical terms.
Hemochromatosis.
Hemochromatosis, and have an appointment with some kind of a clinic. I wanted to know if I can get therapeutic
phlebotomies.
You know what those words are? I don't. Is that available in Panama City?
I guess you could donate blood, but and I've heard of people being haven't been suggested that to the phlebotomies, but I mean it must be available. I'm sure I can hook them up with a good hematologist here, which I know one, and he'll have all those options available if that's the best route to take.
Yeah. So Jay wants to know if there's a VA clinic in Panama. There is no VA or Veterans Administration's clinic in Panama. However, many of the hospitals, including Pacifica Salud, they do take Foreign Medical Program, TRICARE, and CHAMP VA. So they do handle veterans. It's just there's not a VA hospital.
And I believe now at the lobby of Pacifica Salud, there's a person there just for the VA people. Okay, the information, to give them information on how they can help.
Okay. Do they have cancer treatment facilities like chemo infusion centers, radiation therapy, things like that in Panama City?
We do have a cancer treatment, right? And there's the new cancer hospital they just opened up in the City of Health that they closed the old one down. But I mean, yeah, we definitely have cancer treatments available here because we have cancer patients.
Yeah, and not just in Panama City, that's available
throughout the country.
Oncologists and cancer treatments are available in Chitre and David and other parts of the country. By the way, if any of you have questions about a specific medication and if it's available or not in Panama, go to our website at PanamaRelocationTours.com and search drugs in the upper right-hand corner. There's two links in that article. One is for farm value, another one is for Arocha, and there you can search medications to see if they're available and what their costs are. If it says not available, don't worry. That doesn't mean that it's not available. It may only be available at a hospital pharmacy. We have a list of hospitals also. You can contact the hospital pharmacies to see if it's available.
Right, and they have WhatsApps too.
Yeah.
So you can do
or do telemedicine with Juan, with Dr. Carbone, and he can evaluate your situation and let you know if the medications are available. So Ernie wants to know, I have a high count of red blood cells. I go to the Red Cross at their blood bank 3 to 4 times a year that they call reds. Can you do this? They extract the red blood cells only. That's a new one.
That's a new one for me too, but I'm sure that can be done in the lab in the blood banks.
Yeah.
But you have to ask, but I mean, it doesn't sound that unreasonable.
Yeah. By the way, speaking of labs, I think we should bring up that you can go to any laboratory here in Panama and you can order pretty much your own lab work. You can say, I want to get, they have this list of different panels that you can get, and you can do that, but it might not answer the questions that need to be answered. So it's really a good idea to have a consultation with your doctor first and let him know what's going on and how you are, what medications you take, and then let your doctor recommend which lab work that you need to have. People are tempted to skip that step, but it's much better to have your doctor make a recommendation on what lab work you need to get. There's no need in spending money on something you don't need, and you don't want to make a mistake of not getting an important lab work that you do need.
All right, save you an extra trip to the lab. Go back, pay for the additional test that you forgot to get, right?
Mm-hmm. What about Parkinson? Are there treatments for that available in Panama?
Yes. The levodopa. Yeah, we definitely have treatment for we have Parkinson patients here. I have a few.
Okay. I'm clicking on the wrong ones here. Hold on. Can I use Medicare supplement plan, or is it better to purchase Panama insurance? You cannot use any of your Medicare supplement plans here in Panama. If you convert to a Medicare Advantage, then it's available for urgent care and emergencies at certain hospitals like Pacifica Salud or Hospital Cherokee and David, and there'll be other hospitals that are added soon, but Medicare or any of the Medicare supplements you can't use here in Panama. If you don't qualify, if you want to get a broader insurance than just something that covers urgent care and emergencies, there are plenty of health insurances available here in Panama. On our website at Panama Relocation Tours, just search in the upper right-hand corner health insurance options. I have a list of all the different health insurance options and a link to the brochure so you can learn just a little bit more about the insurance. And we also have recommendations and an online guide of insurance agents that can help you find the best insurance for you. So Tracy wants to know, do Panamanian medical systems use the ICD medical coding for diagnosis?
We do. We actually do. I mean, the platform I use in the office does. I mean, I don't memorize the codes, but the code will always pop up in there. And for the insurance claims, they'll ask for the code too.
Okay.
So we do. That's in the system.
Is it possible to have a hernia surgery in Panama without being a citizen or a resident? And do you have any idea what it would cost?
I'd be guessing on the price, but I mean, I'm sure it would be a fraction of what it would cost you up in the States. But definitely, I have
it's usually about 90% less. Yeah. I do have a really good friend that about 7 years ago, he lives in New Jersey, and he came down on Thanksgiving weekend in the United States. He came down to Panama to have hernia surgery because it was going to cost like $70,000 in the United States, and he came down and he got the specialty at Pacifica Salud. He had that done. He got some dermatology work done. Went to a dentist. Spent a couple of weeks and just said, "Fix me up," and they took care of him.
Yeah, but the hernia definitely under 5,000.
Yeah. So Catherine wants to know, would a person that has a lot of insulin flex pens have any issues bringing the pens with them to Panama through customs, or could they have been sent via email?
Via mail. No, that shouldn't be a problem, especially for insulin, something that you need. Yeah, that they're not going to give you a problem for that.
Yeah. Are the Punta Pacifica Hospital and Pacifica Salud Hospital one and the same?
Yes, they are. It's just that it changed the name. At first it was just Punta Pacifica, and then when we decided to open up a branch in Costa del Este, can have a Punta Pacifica and Costa del Este would be confusing, so I changed it to Pacifica Salud and then the Punta Pacifica
Right.
branch and the Costa del Este branch.
That's
But
another.
yeah, the new name's the Pacifica Salud.
It's the same thing. It's another good thing to bring up is that you have two locations, not only in Panama City, close to Multiplaza Mall, but you also have another location in Costa del Este.
Yes, and they're both in Panama City, but you know, two opposites, right? So whichever's closer to you, especially for an emergency.
Mm-hmm. Jane says, are there neurologists that specialize in essential tremors?
I don't.
Probably would have.
I mean, I'm sure a neurologist could handle your tremors. I mean, that definitely. I'm not sure if that's a subspecialty on it, but I'm sure any neurologist in Panama, the ones that I'd recommend, definitely perfectly handled to handle your essential tremors.
Yeah. So Chuck and Debbie, they ask a question about doing health screening, and we'd already talked about that yes, they do a complete health screening. If you want to have a little bit of everything checked out, then you can do that at Pacifica Salud. By the way, Juan, Dr. Carbone, he does telemedicine. You know, before you even move here, you can have a consultation with him to ask questions about your personal situation. Or once you get to Panama, you can go into his office in Pacifica Salud and meet with him there. At the end of this live stream in the show notes, I'm going to have his contact information so you can get in touch with him. Jamie says, does Panama have audiologists and ear, nose, throat surgeons for deaf and maybe getting a cochlear implant?
Cochlear implant.
Yeah.
We definitely have ENTs and audiologists here. I'm sure that could be figured out because we have deaf people in Panama too, that use those implants, right? So I have never been close to that experience, but I'm sure it must be available. I mean, Panama's, you know, it's advanced in comparison in the region, like the most advanced place in the region, I'd say.
Yeah, I know a lot of people that have gone to an audiologist and they've gotten hearing aids here in Panama.
Absolutely.
So Ann says, how often do doctors do stents for aneurysms? Do cardiologists do open heart surgeries? I'm
not sure how often do they do them, but the open heart surgeries are done. Obviously, they prefer the going through the neck or in the thigh, which is a lot simpler cutting it open. But if so, they can do the angiogram and fix it that way, it'd be better. But if it's necessary to cut you open, definitely would be cut open in your sternum.
Yeah, they can take you. We've had many of our clients have had stents put in, knee replacement, hip replacement. You know, there's nothing here that there's nothing that I don't think you would have to go back to another country for. It's available here. Even somebody needed to have some really delicate eye surgeries done at Pacifica Salud, and she contemplated going back to the United States to have it done, but you know, she lives in Panama. She wanted to have it done here. All her friends and her brother lived here, so she decided to have it done in Panama. Right. So what about medical marijuana dispensaries? When are they ever going to be available, do you think?
Well, they passed a law a little while back, but that's taken a while because they're trying to monopolize on it, and you know, they got caught, and who knows. But I mean, eventually it's got to come to fruition, right? It's just that hold your breath in the next couple of months, right? Yeah, they've been saying that for a couple of years. But the thing is that when I've read all the arguments and stuff about it, and they said mostly that they were going to use it for people that epilepsy or terminal cancer patients. It's not going to be like it is in some other countries where you can get a medical marijuana card and just have a dispenser and get it because your elbow hurts or whatever. So it's gonna. I mean, it's for sure. It's gonna start with just epilepsy and those kind of things, and eventually we'll get laxer.
Maybe someday.
Yeah, because I mean the law's there, right? So just gotta wait. Just
gotta wait. Catherine says, would it Advise the person who's had a kidney transplant to move to Panama. Would they be able to acquire the meds that they need?
Yes, most likely. Most likely. Absolutely. Yeah. Kidney transplant. Yeah, because we have kidney transplanters live here. All right.
Mm-hmm.
I think we've done kidney transplants here in Panama.
Yeah, one of the things that you might want to do, Catherine, is make sure that you check the price of the medication that you have to take for the anti-rejection medication and see what it costs. Jan says, I'm a Canadian going to Panama for 5 weeks and I want to get a full body scan for cancer. How can I get this done and about what would it cost?
I think Jan's talking about the MRI, the body MRI. That usually set you back about $1,800, $1,900.
Is it called a PET?
No, it's an MRI, a complete body MRI.
Okay.
So check for everything. But I checked on that for a patient that asked me about it. So that's why I'm
right.
$1,900 for the full body MRI.
So once again, if anybody has any questions about a particular medication, you can go to our website at Panama Relocation Tours and search drugs. And there's a link to 2 pharmacies there where you can check the availability and the price of medications. Are there life flights available from Boquete to Volcan or David or Panama City? There is. It's not called life flight, but there are some flights that are available. So if you had some kind of a major medical emergency, and let's say you were in Coronado, where there's not really a hospital in Coronado, except for the public hospital in San Carlos, or going to Pananomi, and you wanted to be transported back to Panama City to go to Pacifica Salud, there is an air ambulance that's available. A
helicopter. I saw it recently.
Helicopter. Yeah. So on the 18th of December, I'm doing a special live stream to talk about air ambulances, other ambulances, and how you can use your Medicare Advantage and other U.S. insurances here in Panama. So mark your calendars for the 18th. Is there LASIK or crystal lens replacement?
Yes, definitely. I had LASIK done on this eye, so we do have it, and great. It went great.
Yeah. Do you know if you can get stem cells here in Panama? I think there's
yeah, we do. It's in the Hilton building. Picard building, that tall one in Avenida Balboa. Yeah, it's. I know that I can give you the contact of the place too.
Yeah.
But it's big. I think Mel Gibson's father came down here for that, and Joe Rogan's father or mother or something. But
yeah. Check out the YouTube videos about cell medicine in Panama. Mel Gibson, do a search for that. Mel Gibson's dad was confined to a wheelchair. He couldn't even walk, and he came to Panama, and he had a couple of stem cell treatments, and he was able to get up and walk, and he's still doing just fine. So they have a testimonial about that on YouTube. Check it out. So Christine says, if my deceased mom was born there, is it better to go to Panama to apply for residency? So that would really be a question for an immigration attorney. So we have a list of immigration attorneys in our online Panama relocation guide. You need the birth certificate and death certificate for your mom, and then consult with an immigration attorney. How would a hip replacement cost at a private versus a public hospital? So he works at a private hospital, so he doesn't really have information about public.
Okay, yeah, but and the hip replacement, that would require a lot of things from the patient too before they can give an estimate, because I had that query from somebody, and I asked the surgeon, and he needed more information on it to give me a quote first.
We do have a video from about 2 or 3 years ago of a lady that did have, she lives in Volcan, but she had her hip replacement surgery at Hospital Cherokee and David. So do a search through our YouTube channels of having surgery in Panama, and I'm sure you'll find that when she talked about the procedure, how long she's in the hospital, what it costs. Now, this was several years ago. The prices have probably changed a little bit, but at least you can get a general idea. And is artificial heart valve considered a pre-existing condition? Yes, it would be considered a pre-existing condition for medical insurance. That's the thing about insurance here in Panama. If you're getting like any of the insurances through a Panama company, any pre-existing conditions, they're usually going to exclude it for at least the first. Maybe they will just say we won't write a new policy, but they may say we're just going to exclude it for the first 2 years. And if you don't have any problems with your heart or whatever it might be, then we'll insure you at 50% after those first 2 years. But any questions about can you get insurance should be directed to an insurance agent. Are there any cosmetic surgeons in Panama?
Absolutely. I can point you to the best one. No
doubt.
Is
that your dad or your brother?
My uncle.
Your uncle. Yeah, I thought so. I do know several of our clients that have been to him, and they say he's fabulous. So yes.
Yeah. Do
any doctors offer home visits?
In the city, I think it was the mini med will do that. I think the mini med, or in the beaches area, the guy I mentioned, it's willing to go to Gorgona and San Carlos and all those the beach areas.
Yeah, very often, this is another unique thing about Panama. Very often, whenever you see your doctor, they'll want to, especially if you've had like really high blood pressure or they've prescribed some medication, they're going to follow up with you. They're just not going to say, thank you, ma'am, goodbye. And they're going to follow up with you. So you're probably going to get your doctor's cell phone number. And don't abuse that just because you have their cell phone number. Don't share it with a lot of people. But if you were having some kind of a really important medical emergency, you could send them a WhatsApp, and if they were not available, they may have a colleague or that could come over and take care of you, or arrange to get an ambulance to get you picked up and get you to the hospital as quickly as possible.
Absolutely. It's happened before.
It's happened before. Yes, it has. Just going to take a couple more questions. I so much appreciate you answering all these questions. Thank you.
Oh, my pleasure.
Han says, do retired Americans who move to Panama typically discontinue Medicare to save money? Some do and some don't. Some convert to a Medicare Advantage plan that will cover emergencies in Panama, like a heart attack, a stroke, car accident, things like that. And then they still have access to the Medicare back in the United States. But if you're on a really tight budget and that you can't do that, then some people discontinue it. Sherman wants to know, when looking at the list of drugs available in Panama on the PRT website, is there a way to tell if the drugs are available OTC or just prescription?
There is, Jackie, because in the app, the Pharma Value app, only the OTC drugs are going to show up.
Yeah.
So if it shows up, it's OTC.
Okay. So that's important to know. Also, remember, if your drug doesn't show up on that list, you may have to call one of the pharmacies at a hospital. And just a little bit of advice, if you take like 10 different pills, don't call the hospital pharmacy and try to communicate with them and say, well, I want to know if you have this and this and this and this and this, and what does it cost, and 5 milligrams versus 10 milligrams. Just don't, because they're busy. So don't take up a whole lot of their time. You might get a list of some medications. Also, there's a company that I know, it's called simplifypanama.com. The owner's name is Julie. And if you contact Julie, because if you call the pharmacy, they might not speak English, but Julie is bilingual. You can contact Julie at simplifypanama.com. I think she charges $20 to do drug research for you, but you give her the list of medications. She'll call several different hospitals, several different pharmacies, and give you like 4 different prices and see what's available at each one of them. So don't forget, Julie at simplifypanama.com can do that drug research for you. Or you can have a teleconference with Dr. Carbone, and he can do that for you too.
Of course.
And Cara wants to know, do you have to have cash on hand when you get care, or do the hospitals bill you? So usually you have to, if you don't have insurance, you've got to have a credit card and pay like $5,000 if you're going to be admitted, or $500.
Depending on the circumstance. But
yeah.
I mean, definitely not cash, the credit cards. Definitely the major hospitals will all take credit cards.
Yeah. Are doctors there able to treat blood disorders such as counting blood platelets?
Absolutely. Got definitely great hematologists here. Definitely equipped to handle that, no doubt.
Yeah. So I want to thank you so much for taking the time to answer all of the questions. I'm sure we could go all night long with all the questions that people have for you. The best thing to do, if you have questions about your specific situation, if you can get treated here with whatever your medical conditions are, if your medications are available, the best thing to do is to set up a consultation. And you can do that. We have an email. I'm going to provide an email or a WhatsApp number for his office where you can set up an appointment. He can do telemedicine, which would be similar to what we're doing right now. Or if you're going to be in Panama City, go by the office and have a face-to-face meeting. And then he may order, some blood tests to give you, because without blood tests, you can talk all day long, but without blood tests, they tell the true story. So without blood tests, it's kind of hard to know what's really going on. And even if you did telemedicine, if you weren't in Panama yet, your doctor might say, well, you need to do some blood tests and get this and this and this tested, and then send me those results, and then I can tell you what's going on, because that's what tells the true story. So thank you again so much for joining us for this live stream. It was very informative for everybody. Guess what? He speaks English, like many of the doctors do here in Panama, but he speaks Spanish too, for all of you that want to speak Spanish. So thank you so much, everybody. Yeah, thank you very much. And just a quick reminder to everybody that on Wednesday, I would normally do our Move to Panama Q&A live stream, but I'm going to be in Panama City for some important meetings, so we're not going to have a meeting on Wednesday. Monitor your email for updates about oncoming live streams that we're going to have. Dr. Carbone, thank you again for joining us and answering all those questions, and thank you to the 450 people that were on this live stream. Thank you, and goodbye, everybody. Have a good evening.